Ladies and gentlemen, we'll proceed straight to our next keynote, your GPS in the world of healthcare. Here to talk about it, please welcome Stavros Tsompanidis, Chief Product Officer and co-founder at Nexentria. Hello, Stavros.
Hello, hi.
Make sure you're comfortable on our stage, and it's all yours now. Enjoy.
Excellent, thank you so much. Hi, everyone, and it's a delight to see you all this morning. My name is Stavros. I'm going to present about the two passions that I have in life. One is the communicating scientific evidence and talking about the value of medical information in today's age. So I'm going to backpedal actually back in the global pandemic. I know it has been a long time gone now. For many of us, it's like a bad memory. But actually, it was the perfect storm where we can see the deleterious effects of misinformation at a global scale. It became very clear that the power of accurate information is super important. There are decision makers which they're basing their own decisions and policies upon scientific facts. And we also see that emotion may get the best of us. You may ask why I'm talking about the global pandemic at this stage. Well, I have a personal take. I was the global head of medical information at BioNTech for the COVID-19 Pfizer-BioNTech vaccine up until a couple of months ago. My team has answered more than 1 million questions about the product. And I can assure you we have answered all the questions you can imagine based on fake news and misinformation that's available online. So the effect and the impact that scientific evidence has is supreme, at least for me. And also it's super important to remind everybody that since science is becoming more and more complex, the value of medical information becomes more imminent. So let me paint the bigger picture. So I have my colleagues. There are 10,000 of medical information scientists out there, which they work in more than 30,000 products for 3,000 pharmaceutical companies registered with the FDA and EMA. And every year, we answer more than 10 million of questions in order to ensure the safe and effective use of medicinal products and medical devices in the industry. The numbers are huge. Obviously, many people have never heard about medical information before, but this is a service which is necessary by the regulators. Every pharma company needs to have a medical information department, and we operate according to specific standards and timeframes. And also, medical information is the official voice of the company when a question is being asked. This also applies to both patient consumers and healthcare professionals. Obviously, the level of information provided is different, but we also reply to questions from health authorities and payers as well. Looking a little bit at the market itself, so technology, obviously, as you may imagine, technology plays a huge role within medical information. However, it's a very underserved market. So at the moment, what we see is that the average medical information department needs at least 4 pieces of software in order to be able to do their job. So in 2023, that's something which is particularly unacceptable. At the same time, the solutions which are available in the market, because it's a regulated environment, it's not there. So all the solutions that we have are relatively outdated. The latest one that has been actually introduced in the market was back in 2017. So there are 6 years that the market has not followed actually the industry standards, and we see that the product roadmap of the current solutions is lagging. Finally, because also it's a highly regulated environment and we talk about the pharmaceutical industry, the solutions provided are not really cost effective. So what we see the competition has actually done is that they have tried to compartmentalize different processes in order to create ecosystems of different products that they can actually capitalize on and get bigger market share from the industry itself. So here we are at Nexentria. I joined very recently, a couple of months ago. We come in with a very innovative solution. We want to have an all-in-one solution, one-stop shop software which can be used by these departments in order to answer their medical information inquiries. It's fully auditable, and what we want to offer is a robust integration layer that can connect to other solutions, full omnichannel support, as well as be able to deploy as needed according according to the requirements of the customers. Finally, we are also experimenting with different AI business cases for artificial intelligence. This is something which is not particularly straightforward, but we have actually found a path forward on how we can apply those within our software itself. Looking at our current traction, the system, we have already deployed it with the first CRO. We have already been testing the system with 5 pharma companies that they're working with this CRO. It's a fully functional system. It has been validated. We have already 4 successful audits and 1 GDPR audit as well. We are under NDA with 3 pharma companies directly in order to sell our software to them. And we are aiming to find people who actually want to join us, our cause, in order to get more traction and get the word out about our system and what it has to offer. Looking a little bit at the market, so at the moment the global MI market is valued around just below 3 billion. Obviously that's a very hard estimate because of the complexity of the environment itself. But what we see is that approximately 1/3 of the total market is actually attributed to software. We expect with the current digitization efforts that we see within the pharma industry, as well as the need for more specialized software, this to increase within the next couple of years. And we estimate that this will probably reach at 1.5 billion in a couple of years itself. Just also to mention very quickly that at a post-marketing setting, once a product receives its label, usually the 2 pieces of software that the pharma company will actually require to have is a CRM and their medical information database. So I'm joined with 2 more passionate gentlemen here. So Vilius has a background in finance, and Lemon is our Chief Technology Officer, who is responsible to answer any technical questions about our system. We also have an advisory board with 3 pharma industry experts and 2 AI and strategy experts as well. And as I mentioned before, we're looking to find partnerships and looking forward to spread the word about our software and its potential. This is a final summary slide, so I guess if you have any questions, I'm more than happy to answer them.
Thank you very much, Stavros. Do we have questions for Stavros in the context of the concept? Yeah, I may as well share mine.
Thank you. Hi, Sander Rutenberg from Novartis. Can you speak a little bit more to the omni-channel aspects of your system?
So what we have actually seen recently is that we have different, according to digitization efforts, pharma companies, what they're trying to do is create this environment, this omnichannel support, where you can actually address customer questions right at the inception of that. That may be through a patient website, it may be through a healthcare professional portal, it may be through email, fax, and very traditional ways of communicate that. What we wanted to actually do is ensure that we create that ecosystem where all these messages and questions can come to one place, and basically the medical information department can distribute those questions and help with process automation through that. So again, looking into the responses themselves, most of them are being addressed by the customer's preferred way of replying, and obviously most of them are being sent at the time being via email. It's very traditional, but we're looking to explore what other options or channels our customers may want to use in order to address those. I hope that answers your question.
Thank you. Do we have one more? Anyone? If not, all it shows us is that, again, Stavros' presentation was self-explanatory.
Great, thank you.
Thank you very much. Thank you, Stavros. Applause, please, ladies and gentlemen.